The opioid crisis that we're facing in America is one of our most urgent public health threats. And there are several causes to this. One is prescribing, is that we have not trained our doctors and our nurse practitioners and dentists how to treat pain safely and effectively. But we have urged them to be more aggressive about treating pain. We've also seen over the years aggressive marketing of pain medications to clinicians. And we've had a problem over the years with regard to treatment, which is that we have over 1 million people who need access to treatment right now but can't get it because we haven't invested sufficiently in building treatment centers. All of those factors together have led us to where we are now, where we've seen a quadrupling of overdose deaths since 1999. We have nearly 2 million people addicted to prescription opioids. And every day we have over 40 people who die from a prescription drug overdose. That's far too many.
Dr. Murthy, I think it's very interesting that you mention the very aggressive marketing on the part of private companies. We're now in a time when a lot of people in Congress are going after big drug companies for aggressive tactics and for alleged price gouging. Would you characterize this as also sort of calling on the pharmaceuticals industry to police themselves, to say, you know what, you play a role in this as well?
Well, this is one of these epidemics where many people have had a role to play. And that's why to solve it, we're going to need the partnership of clinicians, of pharmaceutical companies, of policymakers, and of families, because everyone has a role to play in addressing this epidemic. And what I would love to see is for clinicians to focus more on sharpening their prescribing practices. That's why I took this step of sending a letter to 2.3 million healthcare practitioners all across the country. This has never been done before by the Surgeon General's office, to call the profession to action around an issue. But I did it because I know that this epidemic warrants it. And what we're asking every clinician to do, in addition to sharpening prescribing practices, is connect patients who need treatment to the help that they often don't have but urgently need. We're also asking clinicians to help change how our country thinks about addiction. We have a problem right now, Melissa, in America, where too many people think that addiction is a bad choice, that it's a moral failing. What they don't realize is that this is a chronic illness. This is a medical condition that requires treatment, and we have to make sure people who need it can get it.
Well, and Doctor, that's part of the problem. And coming up in the next hour, we've got the author of a book that I just recently finished called American Pain, about a huge Florida pill mill whose founders, by the way, are now in prison. But yet we're still seeing millions and millions of oxy tablets and pills created every year, even as most doctors will tell you they understand it's one of the most addictive substances on earth. In many ways, it is heroin. How do we now back off this? How do we tell the 1 million+ people that suffer out there or are addicted, sorry, we're going to pull you back off this?
So you bring up a very good point, which is that the pendulum swung to one extreme about 20 years ago or so, when we asked people to be more aggressive about treating pain but didn't give them the tools and the skills to do so. What we have to make sure is that in this effort to address the epidemic, we don't allow the pendulum to swing to the other extreme, where we deny people who need opioid medication that treatment. And that's why, in order to find the right balance, we have to ensure that we are training our medical professions adequately. We've made progress on this front, with medical schools and residency programs increasingly stepping up to the plate. But we have more work that we have to do. You know, when I was in medical school and in training, I was actually taught, like many doctors, that opioids were only addictive if they were prescribed for legitimate pain. I later learned that that was not the case, but I still meet doctors all around the country who haven't realized that and haven't made the connection between their prescribing practices and the epidemic that's out there. There are pill mills. There are a small number of clinicians out there who are prescribing a large number of medications like opioids without proper indication. But that's a small percentage of doctors, and we have to make sure we focus on improving practices across the entire profession.
Doctor, excuse my ignorance, there was something I didn't understand. You said you were instructed when you were in school that they were only addictive if they were prescribed for pain. Did I understand that correctly? And I don't understand that at all, if that's the case.
Well, yes, many clinicians were taught that if somebody has legitimate pain and you give them opioid medications, that they won't get addicted to those medications. And we now know that that's not the case. We know that these are highly addictive medicines, which is why we have to make sure both clinicians and the public recognize that. That's not to say that we should never use opioids. Sometimes they are the right medicines to use, but we have to use them cautiously. And in the letter that I sent to clinicians, I also included a pocket card which guides them in how to approach pain. And some of the things that we tell clinicians are, number one, to think about non-opioid medications first. Second, if they have to go to opioids, to use the lowest possible dose for the shortest possible time. And third, to make sure that their patients understand that these are addictive medicines and they should store them safely where other people can't find them. I tell patients often the worst place to keep your pain medications is in the medicine cabinet because that's where it's easy for other people to find.
Dr. Murthy, if we can switch gears right now, want to go to Mylan and the EpiPen controversy. Where do you stand on a $600-something list price for the EpiPen and Mylan offering a generic version for $300?
Well, I was deeply disturbed when I heard about the price increase for EpiPens. I've cared for many patients over the years who required EpiPens and whose children require EpiPens. And my concern more broadly about drug pricing is that we have millions of people in America who are struggling to afford the medications that they require to stay healthy. And if we really want to focus on keeping people healthy, on reducing the incidence of disease complications, then we've got to make sure that people can get medications at affordable prices. And the recent price increase that we saw runs counter to that effort, and that was deeply concerned by it.
Where do you stand on the issue, the accusations that the FDA is too slow in general when it comes to generics?
Well, the FDA certainly recognizes that access to medications that are affordable is incredibly important, and they've been working very hard to improve their processes to ensure that medications are studied rigorously, but they're made available as quickly as possible. That balance between safety and getting a medication out quickly, it's a tough balance to strike. But this is a priority for the FDA, and I know they're working very hard on it.
There are multiple drugs, doctor, that cost more than $100,000 per year. Gilead's Sovaldi is $1,000 per pill. How did we get here in the first place?
Well, I think we've sometimes asked ourselves the question, how much will the market bear in terms of cost? And we've priced medications on that basis. But to me, as a doctor, thinking about the patients I've cared for over the years, thinking about my role as Surgeon General and the millions of people in America whose health I'm thinking about, my greatest concern is about whether patients can afford those medications. And that has to factor more into our decision-making as we price drugs. At the end of the day, if we are not doing everything possible to support the health of our people, then we're not doing our job. And as a country, we have had a problem over the last many decades where we have not focused enough on prevention, on addressing problems early enough. We've waited until they've blossomed into crises. And we can't afford to do that anymore. You know, we see that with opioids, where we recognize that we have a major gap in treatment. We have to invest in treatment. We haven't yet done that. You know, the President has asked for over $1.1 billion in additional funds, largely to expand treatment. And we haven't gotten that money yet, and that's important.
When you point out that we've asked in the past, how much will the market bear, that speaks to the profit motive of the pharmaceutical sector. Do you think it's bad for the pharmaceutical sector to have a profit motive?
Well, I don't think it's bad for us to have businesses that prosper in America. I ran a technology company before I was Surgeon General. I've practiced medicine. I've operated in different settings, and I understand that healthy business is a part of our country. It's a part of our economy, and it's important. But what I think we have to strike is the appropriate balance. And when we see massive price increases that put life-saving medicines out of the reach of people who need it the most, to me, that's a clear sign that we have not struck that balance.
Dr. Murthy, how bad is Zika? Certainly there's a lot of media attention to Zika, and I'm sure in Florida there's a lot of attention to Zika. Are other parts of the country underestimating the spread of this virus?
Well, I worry that as a country we are underestimating the impact of Zika. As I travel around the country, I often ask people, how many of you have heard about Zika? How many people are worried about Zika? And what I find is that most people don't think that they need to worry too much about the Zika virus. But here's what I say. You know, we have seen an explosive spread of Zika in the Americas since 2015, starting in Brazil, but also in other countries in Latin America and the Caribbean. And now we have seen the local spread of Zika here in the continental United States, in two areas in particular, in Miami-Dade County. And so if we want to prevent some of the adverse outcomes related to Zika, particularly the birth defects that occur sometimes when pregnant women are impacted by Zika, then we've got to focus on prevention. We have to focus on developing a vaccine. We have to focus on mosquito control. Now, right now, we've invested a lot of time, money, and effort in those areas, the federal government in close partnership with states and local communities. But we have to make sure that we have the resources to continue doing that in the months ahead, because the mosquitoes aren't going anywhere, and we've got to make sure that we're prepared.
Hey CNBC fans, thanks for checking out our YouTube channel. Here you're going to find videos packed with all of the information that you need to be smarter about your finances. You can subscribe by clicking right here and click on all the videos around me or the eye right here to watch the latest from CNBC. Thanks for watching.